Posterior body lift, Brazilian buttock lift surgeries. These are basically surgeries to contour the back and or the buttocks. Posterior body lift surgery is basically, it's also called a belt lipectomy because we're basically taking a scar, which is often, some patients have often, is the second stage of an abdominoplasty where the scar goes to here, and the scar is being extended around to the back so it looks like a belt, so it's called a belt lipectomy. If you've never had the tummy tuck and you're only going to have the scar along the back, we call that a posterior body lift. And basically you will have a scar on the back that's right above the buttock, and we basically do liposuction at the same time, and we take the excess fat from above the buttock and often on the sides, and we lift the buttocks up, and we'll put sutures in there to basically try and suspend the part that's dropped. The risk of the surgery, there's a risk of bleeding, infection, wound complications, as there are with all surgeries. But gravity being what it is, at first you're going to be kind of what we call high and tight, and then it tends to settle. So we're basically removing the excess fat and skin. There's a risk of contour irregularities as with liposuction. Now, whether or not we combine that with what's called a Brazilian buttock lift, which is actually taking fat from different parts of the body, often the fat right above the buttock, and grafting it into the buttock. That can be done by itself. It can also be done in conjunction with posterior body lift. Just so you understand also, Brazilian buttock lift is called the Brazilian buttock lift because of the contour of Brazilian women is very typical to have what's the concavity above the buttocks. So it's not so much that the buttocks are being made larger as much as the area above the back is kind of being hollowed out with liposuction. So that is what actually adds to the bulk of the, the title. But with Brazilian buttock lift, we were basically taking that fat, we're spinning it down and processing it and then grafting it into the buttock. So one of the things with Brazilian buttock lift is that anytime you do fat grafting, we expect that half of it's going to go away. And there's a limit as to how much we can actually graft, but half of it goes away. You also have to lie on your stomach or in a special chair called a BBL pillow, which will have been discussed with you for 2 weeks, because if you sit on the fat, it can also expedite it going away, which we want to minimize. More serious complications or risks of Brazilian buttock lift is something called a pulmonary embolus, a fat embolus. So if you notice any acute onset of shortness of breath, you need to let us know. Now, the way we do the procedure, the risk of a fat embolus is significantly higher when you graft it into the muscle, which we don't do. We do on top of the muscle, under the skin. So the risk of it is much, much smaller. But it is a risk that you have to be aware of. And there's a risk of contour irregularities. So we obviously will inject the fat in a way to try and maximize the contour, and then there'll be some massage afterwards that you'll do. But there is a risk anytime you inject fat that you can have contour irregularities. And then lastly, whenever you do surgery, whether it be fat grafting, Brazilian buttock lift, there's risk of scarring. So the risk of scarring is 100%. You will have scars. The only thing we can guarantee about it is that you're going to have them, and we will do everything we can to try and minimize the appearance of it.